I've been a childbirth educator for 28 years. Holy cow. I teach also breastfeeding. I've been teaching prenatal yoga for a couple decades, and I am a lactation educator, counselor. I work at the Mother's Boutique in La Jolla, soon to be working at the Mother's Boutique in Encinitas. So sometimes if you call with some breastfeeding questions, you might get me, and hopefully I can help you. Usually I'm able to help. So the first thing I'm going to bring up is in here, it looks, you should all be able to see. If you are oops, where'd it go? If you're a Qualcomm employee, let me scroll back up here. If you're a Qualcomm employee, there's a link right here. Hopefully you can see this in the chat box. There's a link for you to click on for Qualcomm employees or spouse or domestic partners and you're on the Qualcomm medical plan. Click that link so that you're eligible for the Live Well Health Wellbeing Incentive. And then we also ask if you just take a moment. It literally takes a minute or two at the end of the class. You can click on the class evaluation. That doesn't just apply to Qualcomm people, that applies to everybody. I want to make sure that you guys all received the class handouts via email. Now, if you didn't, first thing I'd tell you to do is look in your spam folder to see if it ended up there. And if you still didn't get it, you can email, and here's the email. Hopefully you can see in the chat box, I'm circling it with my cursor. And you can send an email to communityhealth@scrippshealth.org and say, hey, I took the orientation and I didn't get the handouts, and we'll send them to you right away. Yeah, and then, of course, visiting hours and guidelines. I'm going to go over that a little bit in the class tonight. So the other thing, too, I want to tell you guys is when I'm showing my PowerPoint, I can never see the chat box. I've tried to fix it, but I can't figure out how to fix it. So if my PowerPoint is up, and it will be for pretty much the whole class, and you have a question, do not hesitate for a minute. Just interrupt me and say, hey, I've got a question. And I will be happy to hear what you got to say and hopefully have a good answer for you. So I'm going to open up my share tray here and get started. So let's see, go to the next one. So tonight's topics: the hospital pre-registration, the prenatal classes that we offer through Scripps, choosing a pediatrician, packing for the hospital, and when to go to the hospital and who to call and all that kind of stuff, and also parking. And let me go to the next slide here. Oops, for some reason, I don't know why. Hang on. Oh, there it goes. Okay. Also, COVID, well, I mean, I guess COVID is officially over, but we do still have some visitation policies, but COVID, and there are still some precautions for COVID. And then what to expect in labor and delivery, and what to expect during the postpartum period after the baby's born, and then going home from the hospital too. So also lactation services. If you have a question?
Well, I'm not seeing the slides change. Are we supposed to be seeing the slides or full screen view or anything like that?
You are. You're not seeing it? Anybody else not seeing it?
I'm not seeing it either. It's I can just see on slide 1 still.
Let me see if I can. Okay.
Okay. Now I see slide 3.
Yeah, I see slide 2.
I came off of it, so I don't know what's going on. Hang on a second. What happened to my? Uh-oh. Wait a minute. It says I'm not in Teams. That's so weird. What
Yeah,
just
we can definitely see your screen, but you might want to switch to full screen.
Well, I was in full screen, but that's so weird.
Okay.
I can see it, Liza.
Okay, I'm gonna come off of. I'm gonna stop sharing and then I'm gonna start again.
Okay.
I love Microsoft Teams. Not. Let's always seem to have problems.
Do you know how to do slideshow?
Yeah, that's what I'm doing right now.
Okay.
Okay, I'm on the first slide. Can everybody see it? There's a picture of a mom and a baby and a nurse. And
No, it's showing the third slide for
Third
me.
slide. Yeah.
it's showing the third slide?
Mm-hmm.
Oh, for goodness sakes. I don't understand. Okay, I'm gonna come out of it. Hang on a second. Let's see. All right.
I don't think, does it matter that it's a protected view?
See, this is so weird because it's
Yeah,
like
you
I'm,
might just want to hit enable editing on the top where the comment is. It sometimes does
Yeah.
weird things if you don't.
It's like it kind of locks it in almost like a PDF world.
okay. Okay, now it's gone. My PowerPoint's gone.
Well, all I see is you. There we go. Okay. Okay. Oh.
Yeah.
Okay, that's not good.
You are. Let me get there. Okay, wait a second. What is going on?
Now you see me. How'd you get me up there?
I don't know.
Okay.
I have no idea.
Well, if I shared a screen, but you can't control it, and it's different than your presentation.
It is different. Okay. Let's see. Oh, yeah. Scripps Hospital Orientation. Here we go. Maybe it was enable editing. Here we go. All right. All right, now let's see. Share. PowerPoint. Slideshow. From the beginning. Can you guys see?
Yes, now you're on slideshow and first
Welcome.
page.
It says first page. Okay, thank you.
All good.
Thanks for your help, you guys. Yeah, ask me about childbirth, breastfeeding, blah, 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 technology, forget about it. Okay. All right. Let's see now. And for some reason, it won't go to my next slide. If I just
keep hitting enter.
Yeah.
There you go.
For some reason, I'm going to have to change this. Okay. Let's see. Lactation services and then questions. Okay, here we go. So prior to today, you should have gone on, you should have gotten a link in the email that takes you to a YouTube video that has the virtual guided tour. So depending on where you're giving birth, there's a different YouTube video for each one of the hospitals: La Jolla, Encinitas, Mercy, San Diego, and Chula Vista. So hopefully you have seen that. And then the handouts, hopefully you've reviewed the handouts. Probably the most informative one of all is the Having a Baby at Scripps frequently asked questions. It's got a lot of really good information on it. And then the comfort measures for labor, some tips for postpartum, and then Scripps lactation services that'll have the phone numbers for lactation services on there, which is a really important phone. Those are important phone numbers. You want to have those at your fingertips. And then if you didn't receive the handouts, like I said before, send an email to communityhealth@scrippshealth.org. So well before your estimated due date, hopefully, you're not due like this weekend or tomorrow. So hopefully you've done this, or you will have this done well before your due date, is to complete and snail mail the hospital pre-registration form. So we don't want you to bring it to the hospital. We want you to stick it in an envelope, put a stamp on it, and mail it. I know there's a few doctor's offices who will have you do it through them, but really only a very, very, very few. So we want you to complete it and stick it in an envelope with a stamp on it and mail it to your hospital where you're planning on giving birth. And sometimes the OB will provide that form, but you can also get it online, and I'm sure that you were given the link to find the form. And then hopefully you have registered and or attended already some prenatal classes, childbirth classes, breastfeeding classes, those kinds of things. And then we ask you to choose your pediatrician before you give birth, and you'll have the name of a pediatrician on that hospital pre-registration form, and pack for the hospital. So these are, first of all, the prenatal classes that are available to you. We do have an e-class. We also have live webinars, and we just began, literally like 2 weeks ago, we have just begun to offer in-person childbirth classes. We don't have a whole lot of them, so if you want one, get on it ASAP, as soon as possible. Some of the, we do have the childbirth preparation classes. No matter what childbirth class you took, whether you took the e-class online or even in person, I highly recommend the comfort measures for birth. Go over all kinds of the techniques that you can use in early labor, or even in the hospital, to postpone getting that epidural, or if you don't want to get an epidural. It gives you all kinds of non-pharmacological tips and tools and skills for both you and your birth partner to work together to cope with labor and help your labor go more smoothly, help it go faster, and for you to find much more comfort in labor. And then I highly recommend you take a breastfeeding class. I talk to a lot of moms on the phone when I work at the Mother's Boutique and Lactation who didn't take a class, and a lot of them said, well, I just followed somebody on social media. Well, that's not going to cut it. I'm going to tell you right now, you got to take a breastfeeding class. It's so worth it. You learn so much, and it really helps to prepare you. And then there's a getting ready for baby class, is a great class. It's usually, well, we do have them in person, again, all kinds of stuff like about breastfeeding, about sleeping, about diapering, swaddling, all kinds of stuff for if you've never been around babies before, you've never taken care of a baby before, it's a great class to take. And then for those grandparents that want to get really involved, the grandparent classes is a lot of fun. And then we do also have a pelvic floor wellness class taught by a physical therapist. So that's a pretty valuable class to take too. I mean, if you can take all of them, well, except the grandparent one, if you're expecting, you're not going to take that one, but you take all of them, highly recommend it. So this is what the pre-admission form looks like. And you'll see we want all kinds of information from you. We also want who you've chosen for your pediatrician. Now, this is always a tricky one for a lot of people because you can't really pediatricians' offices will not make appointments for you to interview the pediatrician. So you probably want to choose someone that's kind of close to you. Not all pediatricians, if you don't have a Scripps pediatrician, they're not going to have privileges at the hospital. but if you choose a Scripps one, they may. But even if your pediatrician that you've chosen isn't affiliated with Scripps or doesn't have Scripps hospital privileges, you're going to be assigned your baby's going to be assigned a pediatrician while you're at the hospital. So that's the pre-admission form looks like. This is the one you're going to fill out. You're going to fold it up, stick it in an envelope, and put a stamp on the envelope and send it to whatever hospital you're giving birth at. So here's the $10 million question: when to go to the hospital? Everybody always wants to know this. You first, before you even think about going to the hospital, you want to call either your OB or you want to call the hospital before you're going. So you might want to, at one of your appointments, ask your OB's office, shall I call you before I am coming to the hospital, or shall I call labor and delivery? Some doctors prefer that you call the office. You know, you may or may not speak to the OB, but they want you to know. And sometimes it's good to let them know, even when you're in early labor and you're not even close to going, is to give labor and delivery a call, give your doctor's office a call and say, hey, by the way, I'm in early labor and I'll be there sometime today. The benefit to you is that the staff is ready for you. They got a room ready for you, or they've got they've got everything in line to get you ready and into your room and ready to go and get settled so that your labor can progress. Now, there's different sort of thoughts on when to go to the hospital. Most doctors will say when your contractions are 5 minutes apart, a minute long for 1 hour, and that's the 5-1-1 rule. A lot of doctors will say that. Now, if you have never given birth before, after teaching childbirth classes for 28 years, I always tell my students, if you've never given birth before, 5-1-1 is too early. Most first-time parents will go to the hospital way too early. You want to arrive at your birthplace unable to speak in full sentences, having to stop to get through a contraction, kind of even making animal-like noises. That's good. That's what you want to look like when you get to your birthplace. Because that means that you're probably close to 5 centimeters dilated, that's good. If you're not 5 centimeters dilated, you really don't want to be in the hospital yet. If you've already given birth at least once before, the 4-1-1 rule is a good one, and that's an easy one to remember, 4-1-1 information, because oftentimes, so that's 4 minutes apart, contractions 4 minutes apart, 1 minute long for 1 hour. And because if you've given birth once before, labor tends to go a little bit faster if you've already been through labor before. And then when I teach my childbirth classes, I tell people, wait till your contractions are 3 minutes apart and a minute long for 2 hours. 3 minutes apart for 2 hours when the contractions are 1 minute long. Because that's a pretty good, 3-2-1 is a pretty good estimate that, if you can stay home for that full 2 hours, it's your first birth, chances are pretty good you'll be well on your way. Sometimes early labor, it can go really fast, like 4 hours, but it can even last 24 hours and sometimes even a little bit longer. So that's why you want to look at the 3 minutes apart, a minute long for 2 hours, or second or subsequent births, 4 minutes apart, minute long for an hour. So, but if you have any special circumstances, or you've got a high-risk pregnancy, you definitely want to do what your OB tells you to do. And then if your bag of waters or your amniotic sac has broken, before labor begins. Oftentimes, care providers want you to come in within 12 hours afterwards. We do know the research shows that 45% of women will go into labor on their own within 12 hours after their bag of waters breaks. And about 90% will go into labor on their own within 48 hours. But the rest will probably go into labor within 24 hours. And so that's a conversation you want to have with your care provider. Just depends on what kind of birth you want to have and what your circumstances are. But if you definitely want to go to the hospital if you have significant bright red bleeding. A little bit of bleeding, a little tiny bit of bleeding or spotting during early labor is somewhat normal. You might be your mucus plug. Sometimes as the cervix dilates, it might have a tiny little bit of blood, but that will usually look sort of like pinkish. It might look brownish. But if you have bright red bleeding, you definitely need to go to the hospital right away. Call your OB, call the labor and delivery, and let them know you're on your way. These are things that you can learn a lot more about in your childbirth class, and then have that conversation. I always say, always have that conversation with your care provider. We use, in my childbirth classes, in all childbirth classes, we use the BRAIN acronym, and the BRAIN acronym stands for benefits, risks, alternatives. And once you've gotten the benefits, the risks, and alternatives, use your intuition. And then don't forget, there's always the option. N stands for do nothing. So I always say, don't do anything unless you have a conversation using all the BRAIN questions, benefits, risks, alternatives, using your intuition and considering what if we do nothing at all. So here are the phone numbers, and this again will have been available to you in the handouts. So you're just going to call, if you're giving birth at Scripps Encinitas, you'll call that first number. Same with La Jolla and Chula Vista and Mercy, San Diego. So you just want to let them know that you're on your way, and hopefully you've already put that pre-registration, pre-admission form in the mail. So there are some hospital-specific information and specific links for your hospital, and then also in the having a baby at Scripps. No, we still do have some COVID precautions. They've changed so much, but hopefully they're not changing again. It's been so recent that we all of a sudden didn't have to wear masks in the hospital, except if you're in a patient care situation. So you probably won't have to wear a mask in the room, but your nurse is going to have to in the labor and delivery room. So it says currently staff, patients, and visitors at Scripps are required to wear a medical grade mask in direct patient care areas, but masks are no longer required in non-clinical buildings or general areas of the hospital. You can only, moms have 2 other people with you. So maybe it's your birth partner and a doula, or maybe it's your birth partner and somebody else that you want to have with you during your labor. And then if you have children already, only one sibling under the age of 12 at a time, accompanied by an adult, can visit mom after she's given birth. So, and then you can just go, if you want to make sure that nothing's changed before you're giving birth, just go to the Scripps.org and you can get any changes that might have happened. Hopefully we're not going to have any more changes. So in labor and delivery, there's all kinds of things you can do for comfort measures for birth, talking about eating and drinking during labor, having doulas, monitoring, like electronic or external fetal monitoring, and having an IV, epidurals, pain medications, and all the different medical procedures and interventions, and all those things are covered in a childbirth class. And I did have somebody call the Mother's Boutique. This is, gosh, a little more than a month ago. And we were chatting, and I said, well, have you taken your childbirth class? And she said, no, my OB told me I didn't need to. And I would say I totally disagree with that OB. She also said the OB told her that the nurses will be there to help you. Yes, those nurses are there to help you as much as they possibly can. But your nurse, chances are your nurse is taking care of you and one other patient. And they have lots of charting to do and all that kind of stuff. And that's where hiring a doula can come in really handy, because that doula is there, usually meets you at your house and helps you in the hospital. So if you can afford a doula, great. Or make sure you take a good childbirth class. So you probably want to know what is in a labor and delivery room. Now, this is a perfect picture of what it looks like in the labor and delivery room. And there's all kinds of things that you can do to find more comfort during labor. Number one, this mom is using a squat bar. And the squat bar actually attaches to the bed. And what's interesting about a labor and delivery bed, so if I go, let me see, there it is. See the hospital bed here. I'm going to go back to the previous slide. But you see on the left, that just looks like a regular old bed. But on the right, you can see that a hospital bed is kind of divided up into 3 different parts. And you can see the part where her feet would go. That part can actually be, it can be raised up, and it can be lowered down, and it can even be removed too. So if you look at the previous slide, this mom, where number one, she's using that squat bar, they've attached the squat bar and they've lowered the end of the bed so that she's kind of sitting on the middle part, sort of the front edge of the middle part, and her feet are lower so she can get into a good squatting position. Now, in every room, there will be available to you a birth ball and a peanut ball. If you have a birth ball at home, I highly recommend you. If you don't have one, I highly recommend you get one. They're so awesome. And, you are going to most of you are going to be laboring at home for a little while, and you'll find that birth ball. It's just basically an exercise ball, but in my world, we call it a birth ball. So the birth ball is so wonderful. Some people sit on them and bounce. Some people sit on them and sway side to side. This mom here in this bed, number 2, is leaning forward and relaxing on top of the birth ball on the bed. And they can be used all over. You can even use them in the shower, believe it or not. You just put a towel over top of them, and so they're not slippery. So a birth ball is a really awesome tool to use. Number 3 is 4 different ways, and there are even more ways, but and that's where a nurse or a doula can come in, or learning from a childbirth class can come in real handy. These are 4 different ways to use a peanut ball, and a peanut ball, is basically, it's a physical therapy ball, and it's great because you put it between your legs and it helps to open the pelvis a little bit wider. So that can help your baby. Your job is to, relax during your contractions, in between your contractions, and try to move and change positions. And your baby's job is to descend and rotate inside the uterus. And we want to do everything we can to make it a little bit easier for our baby to descend and rotate. And sometimes the squat bar, sometimes the birth ball, sometimes the peanut ball. can come in really, really handy in helping to open up that pelvis and create a little bit more room so that your labor can progress a little more smoothly and a little faster. Number 4 is the toilet. Now, I always get funny looks when I teach this in my childbirth classes, but oftentimes during labor, if we can get mom on a toilet, now this mom is sitting like we always sit on the toilet, right? But she could literally turn around, put the pillow on the back of the toilet or a couple of pillows, lean on the pillows, and she just can labor on the toilet. It's such a great place to labor. Oftentimes we get moms on the toilet, but we can't get them off because they're so comfortable. And you can empty your bladder anytime you need to, which is important. Got to keep that bladder nice and empty. And then at the Scripps hospitals, we do not have bathtubs, but we do have showers in every room. And that warm water is just a heavenly gift. And I always tell my childbirth students, whoever is going to be with the mom, partner, whomever that partner is, I always tell the partner, make sure you bring a bathing suit, because it's okay for mom to be naked in the shower. It's not okay for you to be naked in the shower. So bring a bathing suit and bring a change of clothes, all you partners. You can stand in the shower with her, support her. She can even sit on a chair, sit backwards on the chair, and you can hold the shower head and let the water pour down on her back or even on her belly. The shower is so soothing. And so these are just some of the most available comfort measures that you can use in your hospital room that are right there for you. And we already talked about the hospital bed. And let's see, I'm trying to see if you can see on this. I don't see where you attach the squat bar on the, oh yeah, I do see it. I don't know if you guys can see my cursor on the right-hand side. It's going around and around and around on that third part here. There's like right here, my cursor is pointing. That's where the squat bar attaches. So if you think you might want a squat bar right when you get to that room, that should be one of the first things you guys ask for. All right. Now in your room is an infusion pump. If you have any kind of medication, it's going to be, you'll get it through your IV, and your IV will be attached to the infusion pump. It might be an epidural, it might be Pitocin, but it's going to be basically pumped into your body through this infusion pump.